Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at the coagulation factors. Let's begin. For the coagulation factors, there are 12 coagulation factors. That is factor 1 through to factor 13, excluding factor 6, which we'll comment on when we get there. To easily remember the coagulation factors, I've developed an easy mnemonic, and the trick is as follows. That is the fast potassium toll channels, lost sodium, anticoagulate safe proteins, highly favorable. Fast potassium toll channels, lost sodium, anticoagulate saved proteins, highly favorable. This trick seeks to correspond to the coagulation factors. Let's look at how it corresponds to the factors. So, factor 1 is known as fibrinogen. That will correspond with the fast. Factor 2, prothrombin, corresponding to potassium. Factor 3, tissue thromboplastin, or what is also known as tissue factor, corresponding with toll. Factor 4, calcium, corresponding with channels. Factor 5, the label factor, corresponding with lost. The label factor is also known as proaccelerating. Factor 7, that is skipping factor 6. Factor 7 is known as the stable factor, corresponding to sodium. Factor 8, anti-hemophilic factor A, corresponding to anti. Factor 9, anti-hemophilic factor B, or what we call Christmas factor. Using the Christmas factor, the C in there will correspond to coagulase. The next one is factor 10. Factor 10 is known as the Stuart power factor, corresponding to SAGE. Factor 11, that is the plasma thromboplastin antecedent, also known as PTA, corresponding to proteins. Factor 12 is known as Higman factor, also referred to as the glass factor or the contact factor, and it corresponds to highly. And finally, factor 13, corresponding to fibrin stabilizing factor, or what is also referred to as fibrinase, which is corresponding to favorable. So that is how to easily remember all the coagulation factors with no difficulty, with ease. I believe we are learning something extremely new. Alright, now let's go ahead and comment on factor 6. Factor 6, which is also referred to as accelerating, is found to have no role in blood coagulation, hence has been removed from the coagulation factors. That is how come it is not part of the coagulation factors. Now, to add to that, if you take factor 2, factor 7, factor 9, and factor 10, they are referred collectively to as vitamin K dependent factors. As you can see here, vitamin K dependent factors, they are factor 2, 7, 9, and 10. Why are we saying so? Because their functioning is as a result of the vitamin K dependent carboxylation process. Without the vitamin K dependent carboxylation process, these factors, that is factor 2, 7, 9, and 10, will not be functional. Hence, they are referred to as vitamin K dependent factors. Finally, let's talk about von Willebrand factor. Von Willebrand factor. Alright, when you look here, I've made an asterisk with VWF, that's von Willebrand factor, on top of factor 8. The von Willebrand factor is also known as the factor 8 related antigen. Factor 8 related antigen. And the von Willebrand factor, what does it do? Where is it synthesized and where is it stored? The von Willebrand factor helps in coagulation. How? The von Willebrand factor has two main functions. The first one is that it helps in platelet plaque formation by attracting circulating platelets towards the site of injury. That is the first function. The second one is that it binds to factor 8, preventing its clearance from circulation. And as we'll be talking about in our next video, that is the coagulation cascade, you realize that factor 8 is needed to activate factor 10, which is in the common pathway of the coagulation cascade. Then the next question is, where is von Willebrand factor produced? The von Willebrand factor is produced exclusively in the endothelium as well as the megakaryocytes. Then the next question is, where is the von Willebrand factor stored? The von Willebrand factor is stored in the Weber palate bodies. The Weber palate bodies. So that will do for the coagulation factors. I believe we have gotten some great understanding. Kindly make sure to subscribe to my channel, like, share, and also comment the next concept you would like to see on my channel. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.